that's, and I'm also happy to encourage people for HB49. It's very important.
Okay, great.
So I'll step in for Susan if she isn't able to step in. I know she's with her parents. I'm heading off for mine at 5 o'clock today. She and I are both blessed to have elder mothers.
Aha. Yep.
I don't know how old hers is, but my mother's going to turn 93
Excellent.
on Tuesday, and I get to be
Oh,
a lucky person to celebrate with her.
we have a lot of birthdays coming up.
Who
Val's
else?
birthday is the 22nd. She says she's going to spend the day at Ojo Caliente.
Oh, I'm
recovering.
jealous. It's free on your birthday, and I love it. And I haven't been there in 3 years because of
COVID. Yeah, me too.
I hate.
Yeah, I must have been pre-COVID too. And then Chris, the chair of our board, Chris Hudson's, his birthday is, Carrie, it's sometime around that time, right?
Yeah, I think it's days after.
Mhm.
Wow.
So all you, what are you, Aquarians or Pisceans or whatever people are? Greetings, Marianne, and greetings, iPhone, and greetings, Vanessa. So this is, and here comes Brenda. So this is probably a good time to invite everybody to introduce themselves in chat. So I'll pull up the screen as soon as a few more people come in, so we don't have to repeat too much. Welcome, welcome, everybody. Thank you. Actually, Carrie, I'm going to turn over the admissions to you, and I'm going to pull up my screen so people know what they're doing here. Welcome, everybody, to our Health Council talk. And surprise, surprise, since it is the session, we're going to hear about yet another bill, 2 bills actually, that have been introduced into the session that we think you would like to know about. So we're going to wait just a little bit more time, give a little bit more time for people to come in. Shelley, are you ready? Is your team here?
My team is here.
Okay, excellent. So, and I can't see the timer anymore. So Carrie, where are we at on the timer? Where are we on our clock? We don't know.
It is noon time.
It's just noon. Okay, let's give it like a minute or two to let people in. Let me get these people in here. Come on in, folks. Okay. Great, nice to see everybody here. Again, could you introduce yourself in the chat? That would be excellent. We'll also be using the chat today if you have questions for our panel, questions or comments for our panel. Whoops, okay. Let's see. Carrie, you give me the go ahead when you think we ought to start, in that I cannot see our clock at the moment.
Let's start at about 12:03.
Okay, which is what, in about 2 minutes?
2 minutes, yeah.
Okay. Hey. So again, I'm sorry you can't see my entire screen because it's popping up all these things, but today is the 17th, and we are going to hear about 2 bits of legislation that have been introduced into the session. Reminder, the meeting is being recorded, and we want to invite you to introduce yourself in the chat, and also as we go along, if you have questions or comments, put those in the chat, and Carrie and I will try to keep track of those so that our panel can address them as they pop up. So Carrie, we ready to begin? Okay, well, thank you all for coming. As always, we like to start our meeting with once again acknowledging that we are on the unceded territory and the ancestral lands of the original peoples of New Mexico's Pueblos, the Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting our relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land. We respect all tribal nations' sovereignty. And in offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. So today we have, I'm going to stop sharing my screen here. And so we can all see each other and we can introduce our panel. I'm going to introduce the MC of the panel, Shelley Mann-Lev, who is going to introduce her team and present this program to us. So Shelley, take it away.
Thank you. Thank you so much. Thank you so much to the New Mexico Alliance for Health Councils and to Carrie and to Wendy and the whole team who support our health councils, and to each of you who are here today who are doing such important work with your communities. My name is Shelley Mann-Lev. My pronouns are she, her, and I'm here as a public health advocate doing work that I started many years ago as the director of the Santa Fe Prevention Alliance, which I had the privilege to found and lead for 10 years. And that work is to really do the best we can do to address alcohol harms in our communities. So we will have 3 presenters here today, and at the end, I'll give you a sense of how you can get involved and engage your health councils in addressing alcohol harms. You'll hear it, I'm sure, more than once, but New Mexico has the worst per capita death rate for alcohol harms in our nation. All of us have been touched, I am sure. I know I have. Dear friend of mine lost her sister. I mean, we could go on. But last year, I mean, when I first started doing this work, we were losing about 1,000 people a year in New Mexico. Last year, 2,274 people died in 2021. So that's the context. Unfortunately, we've made huge strides in DWI, but not in alcohol harms. So we're going to start with, we are so fortunate in New Mexico. For years, I've had the privilege of working with Dr. David Jernigan. He is now with BU. When I first met him, he was with Johns Hopkins Center for Alcohol Marketing for Youth, and his really is the, I'm going to say, one of, it's our nation's expert on evidence-based approaches to addressing alcohol harms, and in particular, the one we're focusing on today, which is singly the most powerful thing we could do to immediately make a difference, and that's to raise the price of alcohol through increasing alcohol excise taxes. And Dr. Jernigan, welcome. Thank you so much for being here with us today. You're muted.
Thanks very much, Shelley, for that very kind introduction. Yes, let's see. I'm going to share my screen. So you now should be able to see the slides, yes? Okay, great.
We can.
So I'm a professor at Boston University in the School of Health Law, Policy, and Management. I've worked on alcohol policy issues at every level imaginable for the last 35 years. Have spent quality time in New Mexico, in places like Gallup, Las Cruces, Albuquerque, Santa Fe, TRC, etc. Really happy to be as helpful as I can to what you're doing in New Mexico. I want to credit this presentation in part to Laura Tometi, who used to be your state alcohol epidemiologist and is now at the University of New Mexico. This presentation was about half done by her and half done by me, and I'm the speaker this time. If there's one thing I want to leave you with from this presentation, it's 4 words. Alcohol taxes save lives. Alcohol taxes save lives. We're talking about excessive alcohol consumption. That's the primary risk behavior we want to prevent. This is CDC's definition of it. Any use by those under 21, any binge drinking, which is 4 or more standard drinks for females, 5 or more standard drinks for male, usually within 2 hours, any use by pregnant women, excuse me, and any heavy drinking, which is a weekly measure, 8 drinks or more per week for females, and 15 drinks or more per week for males. So with those in mind, what does this look like in New Mexico. In 2020, the last year for which we have data, there were about 14.5% of adults who reported binge drinking. About 6% reported heavy drinking. These are both past 30 days. About 29% of high school students said they were current drinkers, and 4.5% of pregnant people drank during the last 3 months of pregnancy. These are all likely to be underestimates. These are self-reports, and everybody lies about their drinking. Everybody lies about their drinking. We use these data primarily because we assume people lie consistently over time, so we can look at trends. And before I go there, let me though just say, when I talk to audiences about alcohol problems, they usually think of two things: drinking, driving, and dependence. Drinking, driving is barely 10% of the adult deaths from alcohol. And dependence, as this slide shows, there are some heavy drinkers, excessive drinkers who are dependent, but 90% of them, of the excessive drinkers, will never qualify for a dependence diagnosis. This is part of why we will never treat our way out of this problem. Instead, we need strong policies like sufficient alcohol taxes. So the other things that alcohol consumption is associated with: more than 200 disease and injury conditions in the body, including chronic diseases like liver cirrhosis, pancreatitis, heart cancers, high blood pressure, fetal and infant health, alcohol use and other psychological disorders, and injury, firearms, violence, including homicide and suicide, motor vehicle crashes, falls, drownings, burns, and so on. I'm sometimes referred to as Mr. Good News. This is, as Shelley referred to, the annual alcohol attributable death rate per 100,000 people for the 50 states. And you can see New Mexico way out in front. And it's been getting worse. All the evidence we have is that people increased their drinking during the pandemic, and this would be fine if it were to ebb again. But once you increase your drinking, it's a habit. It's a habit, and in some cases, it's an addiction. And the concern is that it will not go down again. Here's just the breakdown of the alcohol attributable deaths in New Mexico. Again, look down there at the bottom. That's the motor vehicle traffic crashes. That's 10%. Alcohol use disorders, what we think of as the range of dependent drinking, at most 15%. 75% of the deaths, though, have nothing to do with either of those, and they are, chronic liver disease, cancers. Alcohol is a carcinogen associated with 7 cancer sites in the human body. Female breast cancer in the US, about 15% of cases are considered attributable to alcohol use. A third of those happen at less than a drink and a half a day. Heart disease, stroke, suicide, homicide, poisonings, etc. Underage drinkers, New Mexico youth are above average. That is, your young people drink more than the national average. And then the cost to New Mexico, and this is really important when we start to think about things like taxes. This includes, these are CDC's estimates. The last time this was done was 2010, so that's the year on which it was based. It includes healthcare related costs, lost productivity, costs of fires, criminal justice, property damage, and so on. The estimate was about $2.2 billion a year, the cost of alcohol consumption to New Mexico. That is $2.77 per drink consumed, or over $1,000 per person in the state. And 41% of those costs, just over $1 per drink consumed, are paid directly by taxpayers. Keep that in mind, and I'll come back to it when we talk about New Mexico's tax rates.
Of course, David, that was 2010. That's 12 years ago. That data that's what it's based on, right?
That's right. That's right. Okay, so CDC has an advisory group called the Community Preventive Services Task Force. That is the group that's responsible for looking at all the evidence and reviewing it and making recommendations based on the scientific evidence about what's effective. These are the things that they recommend in terms of reducing alcohol use and problems. And increasing alcohol taxes is perhaps the one with the strongest, one of the strongest evidence bases. For increasing alcohol taxes, they did a systematic review. They found 73 studies that looked at the relationship between either tax rates or total price and either excessive alcohol consumption or related harms. And what they found is, in this respect, alcohol is more of an ordinary commodity than we might think it is, in that when the price goes up, consumption goes down. Doesn't go down a lot, but it goes down enough to prevent some of the worst harms, but not so much that states cannot take in more revenue. That's why increasing alcohol taxes are a win-win-win for states. They are good for public health, they raise revenue, and every time we poll on them, they're politically popular with the population. So also consistent related to, in addition to consumption going down and young people's consumption going down, heavy drinkers' consumption going down, they're also related to fewer motor vehicle crashes, less alcohol impaired driving, less mortality from liver cirrhosis, less all-cause mortality, less violence, sexually transmitted diseases. This is an old slide. We have more studies there that have shown that, and alcohol dependence. So what's the status of this in New Mexico at this point? Well, your liquor tax is about 7 cents a drink. Your beer tax is about 4 cents a drink. Your wine tax is about 7 cents a drink. Want to keep in mind the cost to the state as of 2010 was $1.13 per drink being paid out directly by government. Alcohol is very, very far from paying for itself. All right, so now let me go into a little more of the research behind this. And first, I always like to quote Adam Smith, the godfather of capitalism, who wrote, "Sugar, rum, and tobacco are commodities which are nowhere necessaries of life, but which are become objects of almost universal consumption and which are therefore extremely proper subjects of taxation." Thank you, Adam Smith. In 2019, Mayor Bloomberg and Larry Summers, who used to be the Secretary of the Treasury, headed a global task force on fiscal policy for health. They concluded that if we raise the taxes on tobacco, alcohol, and sugar beverages by 50%, we could prevent more than 50 million premature deaths worldwide while raising $20 trillion of additional revenues. Raising taxes and prices further in future years would save additional lives and raise even more revenues. So what's likely to happen with an alcohol tax in New Mexico? One of the big pushbacks from the alcohol industry is that it will kill jobs. And they're right, it may cause a slight reduction in jobs in their sector, but their estimates always act like that money just magically disappears from the economy, and it doesn't. It gets shifted from a relatively capital intensive sector, which is alcohol production and sale, to an incredibly labor intensive sector, which is government services, healthcare, whatever. So what this slide shows is at various scenarios, and we modeled this using some of the top economists in the country, what would happen in New Mexico at various levels of increases of the tax. In each scenario, as you can see, for instance, for the 25 cents, which is the one that's currently on the table, you get almost 3,000 new jobs if that money was just dumped in the general fund. Gets slightly fewer if you put it directly into healthcare, because healthcare is a little bit more capital intensive. And then who would pay for this? Well, it's important to remember that 49% of New Mexico population 18 plus don't drink. Another 32% are the non-excessive drinkers. They will pay a little, but not very much. The group that will bear the heaviest burden is that 19% of the New Mexico population that is drinking excessively. They will pay 3/4 of this tax increase. So what does this look like in various scenarios for excessive versus non-excessive drinkers. It's not a lot of money per year, depending on how large these are. But for that 25-cent tax increase, we estimated the excessive drinkers would pay about $51 a year. The non-excessive drinkers would pay about $10 more a year. Another argument against these taxes is that they are regressive. They will be hardest on the lowest income groups. And we have looked at that a lot because I don't want to do anything that's going to be harder on poor people. I'm all for health equity and all that. But this is the structure of income in New Mexico. So keep in mind, less than $25,000 a year, that's about 29% of the population. More than 75,000, that's also about 29% of the population. Here's what would happen to the non-excessive drinkers. These are not regressive taxes when you look at non-excessive drinkers. The amount each income group will pay goes up with their level of income. Where they start to look a little more regressive is when you look at the excessive drinkers, but this is exactly the group that we're trying to influence with an alcohol tax. This is the group we want to feel the tax. We want them to drink less. So among excessive drinkers, again, the group that will pay the most is that group earning $75,000 a year or more. This is the group, the segment of the population that has the most binge drinkers in it. There's a little bit of a sag in the curve in terms of the middle income groups. But bottom line is that, again, we have a lot more, you need money to drink. And we have a lot more binge drinkers in the upper income groups than we do in the lowest income group. Couple other things about this. People with lower incomes are more price sensitive. So lower income persons will be more likely to reduce their alcohol use more than higher income persons. So as a prevention measure, this will have a greater impact on the health of lower income segments of the population. So the health benefits from tax increases are progressive. And then the benefits in terms of the revenues are also clearly progressive in that they will go generally into government services, and people with lower incomes are much more likely to use government services than wealthier individuals or households. Now, this is what's happened in terms of the real value of these taxes over time, and these are national figures. It's true at the national figure as well as in New Mexico. Why is this happening? Because most alcohol excise taxes are volumetric. They're based on the volume of the beverage. And how much beer is in a 12-ounce can of beer has not changed at all in the last decades. So the tax rate is flat. It doesn't rise with inflation. It means every year that there is inflation, this industry gets a tax cut, which is basically every year. And it's part of why in the proposals being considered in New Mexico, after a 4 or 5 year adjustment period, there would then be annual adjustments of this tax for inflation, so it doesn't lose its value. Contrast that with what we've done with tobacco taxes, and these are Texas data, but you can see the dramatic differences. In tobacco, we really have used taxation as part of what I would call the prevention infrastructure. We have not done that at all in alcohol. In fact, it's working the opposite way. The result of all this, the price should be right and the price is wrong. Off-premise, at a convenience store, grocery store, whatever, the beer is often cheaper than the water, the orange juice, the milk, the soda. Totally the wrong message for young people. On-premise, bars, restaurants, alcohol is widely discounted with drink specials, ladies' nights, and so on. And as I said, every year, alcohol becomes more economically available because the tax don't keep up with inflation. That 2017 Trump-era tax cut package included an 18% federal alcohol tax cut worth $320 million. So the federal taxes went down even more. According to the Department of the Treasury, More than 2/3 of those tax benefits went to the largest alcohol producers. They were sold to the American public and to the Congress as helping out small business craft brewers, but in fact, 2/3 of the benefits have gone to the wealthiest companies. So in summary, excessive alcohol use is a huge public health issue in New Mexico. We need effective public health interventions to reduce the harm and cost caused by excessive alcohol consumption. And increasing alcohol taxes are very well researched. It's relatively easy to do these studies. I evaluated the 2011 tax increase in Maryland, where they added a 3% sales tax to alcohol. It's currently raising about $135 million, which is going to all sorts of good things. And we found that it led to a significant drop in sexually transmitted diseases, a 6% drop in alcohol impaired drivers on the Maryland roadways, and about a 3.5% drop in alcohol consumption overall compared to what would have been expected. The funds used from these taxes can be used to support other effective interventions. I will close. I can stay on for about 5 minutes and take any questions you have, and then I'm sorry, but I have to go to another meeting. But I will just close by reminding you of 4 words. Alcohol taxes save lives. Your legislators will be most interested in these as revenue producers. But we on the health side, we on the social services side, we have to understand these are not sin taxes. These are not vice taxes. These are life-saving revenue measures. Thank you.
Dr. Jernigan, thank you so much. I do see a question in the chat. We'll just keep you. We are so fortunate Dr. Jernigan did this testimony, which if you, something somewhat similar for the first committee that this bill came in front of. So I do see that Matt Kroskian has a question. Is it okay, Matt? Do you want to read it? You want me to?
Sure, I can read it, but it's in there. I mean,
Okay, go for it, David. Can you see it?
I'm happy to read it. Yeah. Has anyone ever studied subsidizing healthy drinks, making them cheaper rather than taxing what we don't want, which is more alcohol? What if the healthy drinks were the cheaper choice? That is ideally what we would do. And that is what we used to do. We haven't subsidized the cheaper, the more healthier drinks. What we've done instead is tax the alcohol. Our failure to keep those taxes in line with inflation is why we've ended up with some of the unhealthiest beverages being some of the cheapest beverages available. Now, there are all sorts of things that people do around the world, even within the alcohol category, to, for instance, tax the drinks that young people are more likely to be drinking more. What I like about what's been proposed in New Mexico is you're proposing to treat each of your existing categories of alcohol, which are based roughly on how much of the drug is actually in the product. You're proposing to treat each of them the same. That is, a standard drink of beer will get taxed 25 cents. A standard drink of spirit will get taxed 25 cents. A standard drink of wine will get taxed 25 cents. This is a really good public health message, taxing things based on the amount of alcohol in them.
Thank you. We have time for 1 or 2 more questions before we get to hear from our primary champions and sponsors. We're so grateful you're here.
This is Geraldine. I see a few in chat. If I can read them, if that's okay. Joyce asked, "What is a healthy drink?" Maybe, and okay, so that's what I see here.
That's an excellent question. From a health perspective, there is no healthy drink of alcohol, period. There are many reasons that people decide to drink. Your health should never be one of them. The World Health Organization finally announced in the Lancet in January of this year, there is no safe level of alcohol consumption. Now, there's also no safe level of getting behind the wheel of a car. Everybody has to make decisions about risk. But the bottom line for alcohol is there was all that, supposed research about alcohol's good effects on heart disease, things like that. That has been roundly thrashed by my epidemiologist colleagues, and I could go into much greater detail what the problems with it were. And at the same time, it's the cancer data that's really pushing this conversation forward. Alcohol is responsible for 5% of cancers in the US overall. These are completely preventable cancer deaths.
I want to bring up what Joanne is raising, an interesting little factoid that I had no idea. She said the healthier adult beverages still have 4% alcohol. Ranch water, which I'm not familiar with, has 4% alcohol. Are there other drinks that are supposedly healthy that still have alcohol in them?
So part of how the industry is responding to the public health research, which gets stronger every year, is they are saying we are going to make more lower alcohol beverages available. You're seeing more zero alcohol beverages that are branded with the alcoholic beverage brand names. We don't know yet the impact of these on health. What we do know is that globally and in the US, the trend in alcohol consumption is upwards, and it's definitely upwards in the state of New Mexico. So I would not put a lot of credence in the industry's ability to solve our problems by making lower alcohol beverages available to us. We need more evidence-based solutions like raising the tax.
Great. Dr. Jernigan, thank you so much. If you do have questions for him, feel free to reach out to myself, or, knowing him, he'll probably put his contact information in the chat. Again, we are so fortunate in New Mexico. And at this point, we have 3 more speakers. We have Representative Joanne Ferrari and Senator Cedillo Lopez, who are our true champions of this effort. And then Marian Ortega from your own Health Equity Council, Health Council in Bernalillo County, who has a prevention coalition, is going to talk about how she's engaged her health councils. So Representative Ferrari, Senator Cedillo Lopez, I have so much respect for you. Please share with us about the bill and what we can do. Welcome. Cannot hear you.
Sorry. Thank you so much. And it's so great to have such wonderful experts like Dr. Jernigan, supporting what we're trying to do in New Mexico. And he has been so helpful, as well as you, Shelley, to get information to one of our journalists, Ted Alcorn, who had such a great series throughout the summer and even now to help educate people and legislators throughout the state. So it's so great to have his support. What we've been doing with House Bill 230 is to raise the alcohol excise tax. And the most important part is because it helps to reduce consumption, as Dr. Jernigan pointed out, was so effective and is evidence-based. But also we were able to make it so that the funds that come from that increase will go directly into the prevention programs and treatment and what needs to be done to help reduce alcohol use and the harms in our state. And actually, Dr. Jernigan came up with our great fund's name, the Alcohol Harms Alleviation, the AHA Fund. And so we want everyone to have that aha moment when they realize how harmful excessive and heavy drinking is to our state and how much it costs each of us, and as non-drinkers. So we went through last Friday, the Health and Human Services Committee had a great presentation and reception and got the bill passed. And so this next Monday, we will go to the next committee that we were assigned for the tax committee in the House. And so I've been sharing information such as what the PowerPoint that Dr. Jernigan just showed you, as well as other fact sheets and information to the committee members. I'm going to be following up with them this afternoon and this evening when we're on the floor. And hopefully we'll be able to convince them that they need to support this in the tax package. They will automatically table, and so people who are watching, don't be alarmed. There's an automatic tabling in the tax committee, and then they bring it together with other tax considerations and put together a package that will then go over to the Senate side. And so we're, with all the prevention and programs and the way we've set this up to, include a lot of our programs that are already started in our state, and then to expand behavioral health and treatment programs too. We think this is very convincing legislation.
Thank you so much, Representative Ferrari. Representative Cedillo-Lopez, would you please share a little bit more?
Thank you. Well, our strategy is to have a mirror bill in the Senate. And so the Senate bill is Senate Bill 259. And what I want to share with you on the Senate bill, in addition to Representative Ferrari, who both of us are co-sponsoring both bills, but Bill Tallman and Shannon Pinto signed on to it as well. And Senator Tallman did so because he's letting go of his bill. He had a bill to divert funds and, not raise the taxes very much, but divert funds. And he likes our approach. And then Shannon Pinto did that because she read the articles by Ted Alcorn and then came to me and asked if she could sign on because it's such a problem in her district. So I'm very thrilled about it. And what's going on with the bill currently has Representative Ferrari mentioned, these bills don't kind of get, they're not the same way in terms of one bill getting passed all the way across and going to the other side. What's going to happen is the Tax and Revenue Committee is going to hear the bill and then table it. So again, don't be alarmed, table our bill. And the reason we're doing that is because we want the same bill, and we're keeping our bills identical. We want the same bill in both in both areas, so that when they get together, the House and the Senate gets together, that we have the same identical approach to raising the tax. And so I'm really excited about that. Senator Shendo told me, and I'm going to bug him again today, that he thought it would be scheduled next week. He doesn't see a lot of urgency because it's only going to get tabled and considered later. Because I was like, I had another bill involving e-bikes and that went fast. And he said, well, because your bill actually has to go through the process. This one doesn't. It's going to be part of the omnibus. And so that was the explanation to me. So I do expect it next week. I will bug him again today. And I just also want to finish by saying what an honor it has been to work with her and with Shelley Manlev and with Dr. Jernigan, and just the amazing coalition that Representative Ferrari has been able to put together. And I'm available to answer any questions, but I think the presentations so far have been so informative. And that's why I love this bill, because it will literally save lives because of the tax increase and also provide funds to address the harms. Thank you.
Beautiful. Do we have any questions on the bill or the legislative process that you would like to ask the senator or representative?
Before we do that, I also wanted to mention about how after our last Friday's committee that we held a press conference, and it was really well attended by 2 TV stations and 3 or 4 newspapers, the Journal, the Santa Fe New Mexican, and we just got great articles, and they were all so supportive. And so we really appreciated that.
Yeah. It's quite a team, I have to say, hearing Representative Ferrari, Senator Cedillo-Lopez presenting along with Senator Shannon Pinto, excuse me, and Senator Bill Tallman. It's just quite a team. And we had folks from Taos, from the Rio Grande ATP, who also shared recovery community and their own recovery stories. And these funds, what they will do across the board in terms of program support for the Department of Health, for HSD, for people who don't have insurance. Right now, how do they get treatment, or how do they get primary care screening, right? So for people who don't have insurance, Department of Education, prevention, treatment, recovery supports, including social determinants of health, we're talking about an additional $150 million, all of which will be dedicated to addressing alcohol harms.
Thank
So
you
at
for
this-
mentioning. I have to go back to the floor. So thank you all for, being so interested and hopefully very supportive of our bill. This is something that's going to help people across the state, and also programs, and just really glad that we are able to do this. So thank you.
We thank you. And I want to say there's strong opposition, and that's where we need you. The opposition from, even though there's no studies, there's no research to show this harms the alcohol industry. That has never been proven. Those doomsday sayers, your wineries will do just fine because it's across the board. It's throughout the state. And I have to say, when we think about the price of alcohol, it's a small increase. It does have a 7% expected reduction in consumption. That's powerful when it comes to harms. But people are still going to continue to have their, those people who choose to, and those people who are dependent, right? So it's really, again, thank you so much, Senator Cedillo Lopez. Do you want to say something before we hear from Marian Ortega?
I just wanted to say how cool it was that Senator Tallman called them out and said, this is about greed, this is about money. It was amazing, because usually legislators are more circumspect than that. And so I was just like, whoa, I'm glad he's on it.
Yeah, me too. I'm glad both of you are on it, as well as your colleagues. And we need every legislator in the state to be on it. And we hope that you will help, all of you will help activate that. I'd like to introduce Marian Ortega, and you all know her. She works with the Health Equity Council in Bernalillo County. And again, the health councils are such an important, you are in every part of the state, which means every legislator and have the opportunity still to educate, if that's what's, in your wheelhouse. Because again, Preventative Services Task Force says this is singly the most powerful thing our state could do. But Marian, please talk about how you've engaged your coalition. Thank you so much for being here today.
Thank you, Sally. So as she mentioned, my name is Marian Ortega, and I work with the Health Equity Council that serves Bernalillo County. So one of the primary focuses of my work is to reduce underage drinking through evidence-based strategies. So I was really delighted when I heard that there was a possibility of a bill being introduced that would raise alcohol taxes. The first step I took to engage my coalition was I researched a lot of the information that Dr. Jernigan just presented to you all, but a lot of that information was what it currently costs to purchase alcohol through New Mexico, and I was really shocked at how cheap it is to purchase. I also researched what the current alcohol taxes are and found that they have not been raised since 1994. And also looked at the current stats on alcohol-related harms, and this has been not just current stats, but this has been an ongoing issue for a very long time. And even just recently, the news ran a story of a young teenager that was shot and killed here in Albuquerque at a house party where alcohol was involved. So when we think of just all the harms in general that alcohol does, including violence, and the data that shows the strategy works. So where has it been done? What were the positive impacts? So I presented all that info to the community coalition that I facilitate. And then as a coalition, we agreed we wanted to support this evidence-based strategy as it aligned with our work and efforts to reduce alcohol-related harms, including underage drinking. I reached out to Shelley and she did a follow-up presentation to the coalition, and she helped outline a variety of ways that coalition members could support the alcohol tax increase initiative, either as a private citizen or as an organization. Some of those efforts include like letters to the editor, op-eds, providing public comment during committee hearings. And I also went through the Health Equity Council's proper channels and got approval. And as a health council, we probably support increasing alcohol taxes as a public health strategy to decrease alcohol-related harms, while also increasing revenue for treatment and other programs. So that's a win-win right there. Last but not least, from one health council to another, I think we have the responsibility to identify and focus on local health priorities. So here's a statewide issue that needs immediate addressing, and one of the many strategies that you can also advocate for. Thank you.
Thank you so much, Marion. I have to say your leadership, I mean, so the Gallup Alcohol Policy Work Group is the one that reached out to me again, because I had been involved as the director of the Santa Fe Prevention Alliance in this effort starting in 2014, actually. And we brought it to the legislature in 2017. And I have to say, we got and what was the word used? Thrashed, smashed, suppressed, attacked, all those things, because again, there are a lot of people who are paid a lot of money to fight anything that is perceived to do anything that might have an impact on our alcohol industry. This will not harm them. It will benefit all of our communities. So love to hear questions for Marion, questions for me. And I see a couple in the chat. This is great. I'm going to go ahead and if you social host at your home, provide alcohol, and someone drank at your house and caused an accident, then you can be charged. Absolutely. It's rare, Joanne, that happens, extremely rare, but occasionally it does, especially if someone's injured or dies in that kind. We do have what's called dram shop liability, another of the effective strategies. New Mexico has adopted a number of strategies. We have required server training, right? It's called RBS. We're required every 3 years. That's considered to be an evidence-based strategy. Alcohol outlet density, we struggle with a lot more. And some communities have stronger social host ordinances, but we do as a state level have that dram shop liability that holds the server, the seller, the person who provides alcohol responsible up to a maximum for injuries or death or property damage that's caused. So once a bill is passed, how will the funds be distributed to counties? Really important question about revenue, and I know a lot about it. I was engaged in conversations and crafting it. Will the amount of taxation earned with each county return to that county? So again, we're talking about raising close to $200 million. Currently, we raised $45 million. Right now with that 45 million, half goes into the general fund, half about 45% goes to counties, some goes to drug court, and a tiny amount goes to Farmington. And those amounts will be increased in this bill. It's so that the counties that currently they get 22.5 million, they'll get 24 million, same mechanism. Drug court will get a little more, they'll get from 2.5 million to 3 million. And again, Farmington will get a little bit more than it's currently getting for its set aside. But it will go through, as it's laid out, the funds would go through different departments, and there's an outline actually in the bill of what, not the specific items. We did come up with a dream list, and I'm happy to share that. But the wording, and I can pull it up if you'd like me to read it to you. It starts with appropriation by the legislature for alcohol harms prevention, treatment services, recovery supports, behavioral health treatment for justice involved populations, and others not covered by Medicaid or other health insurance, to address social determinants of health related to alcohol misuse, on increase enforcement compliance with the Liquor Control Act, support for victims of alcohol related crime, right? Prevent and reduce domestic violence and sexual assault, which are so heavily heavily related to alcohol. Provide support for people eligible for the DD waiver due to alcohol-related harms. We have about 5% at least of our children being born with FAS or FAE, fetal alcohol effects. To tribal governments and nonprofits to prevent and reduce alcohol harms in Indian country, and up to 10% to match Medicaid funds for alcohol use and substance use disorder screening and treatment. So there's a process, and importantly, money is allocated for an alcohol harms coordinator for the state. You may remember years ago, we had a DWI czar, and we really coordinated efforts. So many departments are listed. It is going to take everybody to do this work. Many of those funds will be available, I'm sure, to counties, but there's a variety of efforts that are needed, and the counties are not alone in needing the resources, right? We need to approach it from many different directions. And that is in the bill, and I will share the wish list copy, which was the basis of writing that technical language. But that language I just read to you is in the bill.
Shelley, thank you so much. This was just an excellent presentation, chock full of information. Those of you that are rapidly taking notes, we will have this information. We'll work with Shelley, make sure we have all of this information available as soon as possible on our website. As some of you know, maybe we'll have this information at our annual meeting and our Public Health Day on Monday, Tuesday. That would be great timing. So stay in touch. Shelley, I think, would you put your contact information again in the chat so people can get a hold of you?
You bet.
And now we're all getting much better versed on how to work our legislative process. So here are two more bills that we want to keep our eye on. As you know, we also have a bill, HB230, that is asking for funding for health councils to actually fully fund health councils in the Alliance so that we can fulfill our mandate to be community health hubs and voices for our community, lift these concerns up to the state legislature. I was happy to see several legislators here. I think we can remind them that health councils are the way to get this message to the community. So Geraldine offered to give us a real quick update, Geraldine, on where we are with HB230.
Yes, I will do that. So I'm going to share screen here. And very quickly, can everyone see the screen pretty good?
Yes.
Okay, perfect. Just for those who are probably new, joining us for Health Council Talks today, House Bill 49 is also known as County and Tribal Health Councils funding. And so what we're doing is asking for a $5.75 million package for funding. And so this includes supporting county and tribal health councils at $125,000 per year. And also to contract with a third party to provide those services, ideally, which we would like to be the New Mexico Alliance of Health Councils to continue the support and the collaboration that we have with health councils right now. And so right now, our primary sponsor for House Bill 49 is Representative Anthony Allison. And so just more recently, the updates of co-sponsors, we have Representative Elizabeth Thompson and Representative Wanda Johnson, and also more recently, Senator Elizabeth Stefanik. So we just want to give a big shout out to our sponsor and co-sponsors for House Bill 49. And so now just very briefly, taking action on House Bill 49. Right now, some of the things that we've been sending out in some of our mass announcements is to email, call, or visit with members of the Senate Finance Committee. And so we have a list of all members and also contact information to follow up with them. Another thing that we're also asking is to email or call the office of the governor to ask for her support in House Bill 49. And sorry. And the last thing is we will be sending out a letter of support for House Bill 49. So if you sign the first two rounds, you could definitely also sign this round for the letter of support. We're going to be as early as sometime next week, we'll be sending out a link for organizations, health councils, community members, and individuals to sign. But you could also sign in person at our statewide meeting that'll be happening on the 20th. And so please don't forget, we do have an advocacy toolkit. It has contact information for all the committees and legislators, also an email template, a script, and then if you are deciding to do public comment, we've also have those available, types of scripts and resources, things that you can reference. And we do have talking points available at this link here. So the last thing is, I know that the Alliance is not going to be able to gather this information, right? We don't have access to this information right now, but you know, as we're kind of coming towards the legislative sessions and towards the end, you know, letting us know if your legislator has committed to junior funding. And so you can email me or you can post in chat if your health council has received or your legislator has committed to give you junior funding. I know that some of our county health councils have been able to do this in the past. So just so that way we at the Alliance can also keep track of the fundings that are coming in and the types of support from different legislators. And I think, Wendy, I'm not sure what's going on in the chat, but are we good here? Any questions on House Bill 49?
Let's see. We do have a question about our meeting. What time is our annual meeting? And are we still able to have walk-ins?
So our on Monday, it'll start at 10 a.m. with some of the board members and starting off some of the annual board meeting, I believe, at 10 a.m. And then there's a lunch. And then also the programming will start from, I believe, 1 to 4. 1 to 3:30. So that's kind of the whole day from 10 to 4 about.
Right. And
we do have an in-person and virtual option as well.
And there's information on our website, correct?
Mm-hmm.
Yes.
I was just going to say Monday morning is the House Tax and Revenue Committee meeting where they're going to be hearing the HB 230. So people are able to come early and even observe that. It's, you know, quite something to watch these committees in progress.
Great. And Brenda, you have your hand up?
Yeah, it's an important question, Brenda. Brenda put her.
I put it
There
in
you
the
are.
chat too.
Yes. Why did today's email ask us to ask the senators to amend HB2? Someone want to explain that? Geraldine, perhaps?
I will give it to Carrie. She's the one who mentioned sent out the email.
Okay, Carrie.
Yes, so we're asking them to amend House Bill 2 because to include some additional health council funding.
Because as you know, this is requesting a good chunk of money for everybody, and so it does have to be included in HB2 in order to actually allocate the funds. We're not sure. I think if it's in HB2, we're trying to find out if it's currently in HB2. I believe, but at any rate, if you could help make sure that it gets into HB2, that would be really helpful. Shelley, did you?
I was just going to say, I'm guessing if you were asked that people have been combing through HB2 and nobody has found it yet.
Okay, it's
So
over
I
100
think- and
pages.
if
I
it does
understand.
not, it's not in the, you know, if it does, it has to make it in. And at this point, the one chance, really, the main chance it has is that the Senate will put it into their budget and then it'll be negotiated in committee with the House.
Right. So
it's-
lots of letters, and use the advocacy toolkit on our website. Let me point out that those templates can be used for the alcohol harms legislation as well. Just substitute some names and bill numbers. But the team at the Alliance, Carrie and Geraldine and the whole team have really put a lot of work into creating templates for you to make it really easy for you to call, email, and or write your legislators to support all this great work that's going on to ensure that New Mexicans are healthy. That's the bottom line. So we really thank you for all our support. Geraldine just put our website in the chat. Are there any more questions, comments from the group? Thank you all for coming. What an important topic. Thank you, Shelley, for putting this panel together. We'll make sure that all that information from today's presentation is up on our website as soon as we can get it up there. And drop in and see us if you're in Santa Fe on Monday or Tuesday. Drop by our table.
I'm going to be celebrating my mother's 93rd birthday.
Oh, that's right. You will not be with us, but we'll be thinking of you, Shelley.
I'll be thinking of all of you, and thank you again
Okay,
for
thank you.
your incredible work on behalf of your communities.
Any other last words for anyone? Questions, suggestions? No? From our team? No, we're good?
No, we just look forward to seeing our all the health councils that are 20th are on the 20th on Monday at annual statewide meeting and public health day. So
Yes, and
Yeah.
all of our public health friends and allies, which is everybody, on Public Health Day on Tuesday. So come on up, drop by. And thank you so much, all of you on this screen, for all the work you're doing, because you're really doing the work. We're trying to support you. Our aim is to help you, help other people be healthy. So thank you so much. Carrie, I guess you can stop the recording, huh?